We're often told that for every problem, there's a pill, that more medicine automatically means better health. But what if that's not the whole story? Today, we're going to dig into a really powerful idea, how sometimes the real path to a healthier life, especially for older adults, isn't about adding another prescription, but about carefully taking some away.
Okay, let's kick things off with a number that'll really make you stop and think. 50%. That's the percentage of older adults with rheumatic diseases, things like arthritis, who are taking 5 or more medications all at the same time. Just let that sink in. That's half of them. A number that big? Well, it makes you wonder what's really going on.
And this quote from Dr. Michael Steinman, man, it just hits the nail on the head. The problem isn't the number 5 itself. The real enemy is when those prescriptions are unnecessary, don't actually work, or worse, are causing harm. So it's not about the quantity of pills, it's all about the quality and the appropriateness of each one.
All right, so that brings us to our first big idea here. We're going to explore why having a medicine cabinet that's filled to the brim isn't always something to be proud of.
It's a totally fair question, right? I mean, we live in an age of medical miracles. We have amazing drugs that save and improve lives every single day. So how can it be that combining them sometimes creates an even bigger mess? Well, the answer has a specific name, and it's a huge topic in medicine right now.
And here is that official term, polypharmacy. It sounds complicated, but it's really just the medical way of saying you're using 5 or more medications at once. And while each individual drug might be totally fine on its own, when you start mixing them all together, that's when you can create a perfect storm of issues.
And the risks are really, really serious. We're not talking about minor stuff. We're talking about a much higher risk of bad side effects, of drugs clashing with each other, or even a drug for one problem making another health condition worse. And what's most scary is that it's linked to things as serious as ending up in the hospital or even death.
So let's dig into that a little. How does someone end up in this situation? Because it's usually not one bad decision. It's often a slow creep, a series of small decisions that just build on each other over time.
One of the main culprits is something called a prescribing cascade. And this is a fascinating but kind of alarming idea. It's like a domino effect. You take drug A, which causes a side effect, but then that side effect gets mistaken for a whole new problem, so your doctor prescribes drug B to treat it. See the cascade?
Let me give you a super clear everyday example. Okay, so let's say you're taking a common anti-inflammatory, an NSAID, for your arthritis pain. Well, a known side effect of those can be higher blood pressure. If nobody connects the dots back to the NSAID, you could easily end up on a brand new blood pressure medication, all to treat a side effect of the first pill.
Okay, so we've laid out the problem, and it can sound pretty heavy. But here's the really good news. There is a growing movement to fix it. And that brings us to the hero of our story today, this thoughtful approach called deprescribing. Deprescribing is pretty much exactly what it sounds like. But I want you to focus on the key words here, thoughtful and systematic process. This is so not about just deciding to stop your pills one day. It is a carefully managed plan, done with your doctor, to weed out the drugs that might be doing more harm than good.
And let's be super clear about what this is and what it is not. Deprescribing is a proactive team effort with your doctor to make your life better. What it is not, and this is so important, is your doctor giving up on you or taking away treatment that works. It's about optimizing your care, not abandoning it.
So how does this actually work? Is it just a guessing game? No way. It's a very structured process, and it's all built around a set of principles that always put the patient's safety first.
So here are the 5 big steps. First up, the review. You and your doctor look at absolutely everything you're taking and maybe more importantly, why you're taking it. Then they consider your personal risk for medication-related harm. Step 3 is to assess each individual drug, weighing the pros and cons for you. From there, you prioritize which meds should go first, usually start with the riskiest or least helpful ones. And finally, you implement the plan and monitor very, very closely to see how you do.
And this flowchart gives you a peek into how a doctor thinks about this. It shows that systematic approach for someone with rheumatoid arthritis. You can see how they'd review everything, all the specific treatments, and make a really careful, evidence-based decision about what to keep and what to maybe stop. It's not random at all.
Now, during that whole review process, doctors are on the hunt for a special category of drugs they call PIMS. That stands for potentially inappropriate medications. Basically, these are drugs that are known to have a high risk of side effects in older adults, where the risks often just don't justify the benefits.
A really common example of a PIM is a class of drugs called benzodiazepines. You've probably heard of them. They're often prescribed for things like anxiety or to help with sleep, and while they can work, they come with some serious downsides, especially for older people.
And here's why. There's this super important guide for doctors called the Beers Criteria, and it flags that in older adults, these drugs can increase the risk of some really scary things: confusion, delirium, bad falls, broken bones, and even car accidents. This is exactly why finding and getting rid of PIMS is so critical.
But you know, when it's all said and done, this whole conversation isn't really about medication lists and clinical guidelines. It's about bringing the focus back to where it always should have been: on the patient, on you.
And that right there is the big shift in thinking. Instead of treating high blood pressure over here and arthritis over there and anxiety over there, all with separate pills, the goal is to take a step back and ask, what is the best plan for this entire person who is living with all these things at once?
This question, this perfectly captures the entire philosophy. This is the one question that every single patient and doctor should be asking each other. Is this pill worth the side effects? Is it actually helping me do the things that I care about, whether that's keeping up with my grandkids, staying sharp, or just feeling good day to day?
And if you're sitting there wondering if this is a conversation you could even have with your doctor, the answer is a huge yes. Study after study shows that patients are actually very open to taking fewer pills, especially when their doctor brings it up as a way to improve their health.
So, we'll just leave you with this final thought. We are so programmed to believe that in medicine, more is always the answer. But as we've seen, sometimes the most powerful, most effective path to better health and a better life might just start with a simple conversation about doing a little bit less.